The main side effects that almost everybody gets include nausea and vomiting. Chemotherapy affects certain centers within the brain. There are certain chemotherapies that do this more than others, and that can create a lot of feeling of sickness. In the past, this was a really big problem, and nowadays it's still a problem for sure, but we actually have very good anti-nausea drugs now, much better than we had 20 or 30 years ago. The next issue, and that affects almost everybody, is hair loss. Hair loss can be very confronting for young people, particularly young women. It affects the hair follicle cells on the scalp and other parts of the body. And the good thing is that once the chemotherapy is finished, almost everybody's hair will grow back. The next major side effects are that it can lower all your blood counts. So your bone marrow makes blood cells that allow your red cells to carry oxygen, your white cells to fight infection, and your platelets to stop you from bleeding. And one of the effects of chemotherapy is that it can affect all of those blood cells. What that means is that you may be at risk of infection during your treatment because your white blood cells are low. You may feel tired and sometimes out of breath because you're anemic, your red blood cells are low, and you may need a blood transfusion. And the other thing is that you can be at risk of bleeding, particularly if your platelet count is low. So some people might get a nosebleed or notice some blood in their urine.